Thank you very much, Time Cyber Media, for this opportunity. So, there are many of us are doctors here, and very few of us have heard about a system or a branch of medicine called podiatry. I am a podiatric surgeon dealing with foot and ankle ailments and diabetic foot ailments. And you might not believe, when I have started my talk now, and by now we have spent about 15 seconds, and one limb would have been amputated in this 15 seconds. Globally, every 15 seconds, one limb gets amputated due to diabetes. And in India itself, there are about 14 lakh amputations that happen annually because of diabetes, which can be prevented. We run a chain of foot and ankle clinics back in Bangalore. And during COVID, where these diabetic foot patients used to come to us every alternate days or twice a week for their dressings to ensure that the wounds get healed properly, was completely off. As our fellow doctor mentioned, that all the wards were converted to COVID wards. Where would these people with the diabetic foot ulcers who needs dressing every now and then will go to? Where would these people the other doctor told about IVF people cannot come to the hospitals. So similarly, where would these people go if there is an ulcer in the foot? This led to a lot of amputations, unnecessary amputations during the COVID period, especially during the first wave. So what we did was, as somebody mentioned, when the government of India legalized the telemedicine, we started training the attendants, the patient attendants in the dressings, the routine dressings. We started monitoring those dressings through video conferences, video calls, and then started developing our own mobile applications to manage those diabetic foot ulcer patients. So we did a study between April 24th and October 2020, and this paper has been published also, where we treated about 124 patients with about 212 ulcers completely remotely, without having them coming to any of the hospitals. And we categorized them into stable, very stressful ulcers and other things. And then there were 2 deaths amongst these 124 patients due to COVID that happened, but we could save their limbs. Only 6 amputations happened of this 124. The India average is about 19% amputations in the diabetic foot ulcer patients, but we had from 124 patients, we had only 6 amputations that happened. So this is the results, and the learnings are that if we train the attendants pretty well, they will take care better than us. So not that I'm negating the role of doctors and nurses there, but surely there is an opportunity to save the limbs in spite of the patients not coming to the hospitals. With this, I end my talk. Thank you very much.
Healthcare Excellence Diabetic Foot of the Year, Bangalore. The award goes to Dr. Sanjay Sharma.
Hi, my name is Dr. Sanjay Sharma, a podiatric surgeon by profession. In India today, we lose about almost 14 lakh limbs due to lack of podiatric care due to diabetes. And we at Foot Secure in Bangalore is trying to prevent amputation